Welcome to Medical Insight, a weekly healthcare feature brought to you by the experts at Essentia Health. Here's your host, Louis St. George.
Today on Medical Insight, Dr. Amanda Noska, an infectious disease specialist at Essentia Health, discusses Lyme disease, a tick-borne illness commonly found in this part of the country.
Throughout Minnesota, it's highly prevalent, but rural areas tend to be more heavily concentrated by virtue of the fact that Lyme has a transmission cycle that involves white-tailed deer and mice and woods. One of the very difficult things about Lyme disease is that it can be confused with other things. Lyme disease can present with headaches. Many people have headaches, and they're not always from Lyme disease, but it can present from headaches. Over half of the people with Lyme disease have profound fatigue. They feel very tired, in other words. Neck stiffness can happen. Loss of appetite, that's very common with Lyme disease. To diagnose Lyme, to actually get to the diagnosis, one thing that is very reliable is finding a bullseye rash on your body. That means you've been exposed to a deer tick within the last 7 to 14 days usually, and it's a sign of acute Lyme disease, early localized disease, and that is a telltale sign that you probably have Lyme disease and should get treatment.
Aside from daily tick checks, Dr. Noska suggests wearing dark-colored clothing, tucking pant legs into socks, and using DEET-containing repellent.
We have a very high incidence here, so removing ticks, if they're stuck to you, is important, especially before they're what we call engorged or full of blood. So you have 36 hours from the time a tick is on you to removal. You're unlikely to get Lyme disease because it takes a while to get into the body and manifest itself as infection.
For Medical Insight, I'm Louis St. George.
This Medical Insight was brought to you by Essentia Health. To learn more about the services we offer, visit essentiahealth.org.